Hello, welcome to the Diagnostic Imaging Center. This is the part of the hospital where kids come to get a CT scan. CT stands for computerized tomography. CT scans are pictures that are taken with a large, special camera called a CT scanner. It takes pictures of the inside of your body. When you come for your CT, you will meet many new people and have some pictures taken with a special camera. But just like a regular camera that you may have at home, this camera won't touch you and it won't hurt when it takes pictures. CT scans can be done for many different parts of the body, such as the head, chest, stomach area, or even arms or legs. Your doctor will decide which part of your body needs CT pictures. Do you know which part of your body is having CT pictures taken? When you first arrive, you will check in at the desk in our waiting room. The receptionist will give you a wrist bracelet that has your name and birthday on it, and some paperwork for your parent or caregiver to fill out. After your paperwork is done, you may have to wait in the waiting room for a little while. This is a good time to play, watch a video, or just hang out with the people who came with you. You may bring a toy or an activity from home to do while you wait. Some ideas are a tablet, a small art project, a toy, or your homework. While you are waiting, a child life specialist may stop by to meet you. A child life specialist's job is to make sure that you understand everything that will happen while you are at the hospital, and help answer any questions you may have. You can also ask the receptionist to page your child life specialist if you want to talk about your CT scan. Sometimes, we may need to give a special medicine called contrast for your CT scan. This medicine helps us take pictures of the inside of your body. There are two ways to get contrast medicine. If you are having a CT scan of your stomach area, you may be asked to drink it. Your nurse will talk with you about how to drink the contrast medicine, such as mixing it with another kind of drink. You can also get the contrast medicine through an IV tube. An IV tube is a tiny, flexible tube that looks like a straw. It goes into your vein, usually on your arm or hand. If you will get the contrast medicine through an IV tube, you will go to the Child and Adolescent Center to have your IV tube placed before you come to the CT area. If we need to take pictures of your stomach area and the area below your belly button, you'll most likely need both types of contrast. Your nurse will let you know if you need to do both for your pictures. You can talk with your nurse or child life specialist if you want to learn more about the IV tube. When it's time to get ready for your pictures, the CT scan team will call your name and walk you and your parent or caregiver to another waiting area. Here you will meet a nurse who will ask you and your parent or caregiver some questions. We will also give you a special pair of pajamas to wear. If you have an IV tube, your nurse may say she's going to flush it. This just means she's going to check and make sure it works well by putting special water in it. Some kids think it feels a little cold. You will also meet the CT technologist, or tech. This is the person who will take your pictures. Before we start, the tech will ask you to practice lying very still. If you are getting CT of the chest or stomach area, the tech will ask you to take a deep breath and hold your breath for a few seconds. Let's practice this together. When it's time to take your CT pictures, the tech will walk you and your parent or caregiver to the CT room. The CT scanner is a large round camera with a hole in the center. It kind of looks like a spaceship or a giant donut. You will see a special bed that looks like a table. This bed moves in and out of the CT scanner. Remember, the CT scanner will not hurt and it will not touch you. Sometimes your parent or caregiver can stay in the room with you during your CT scan. We will give them a special apron to wear during your pictures. Your nurse or tech will give you more information about this on your day of your CT scan. Next, the tech will help you climb up onto the bed and get comfortable, give you a warm blanket if you are cold, and have you wear a special seatbelt. Please tell the tech if you feel uncomfortable or if something is hurting. Next, the tech will move the bed slowly into the CT scanner. You may enter the scanner head first or feet first. This depends on which part of your body is having the CT pictures. Once you are in the scanner, it is very important to lie very still during the scan, just like a statue. You may hear some noise when the CT scanner turns on and starts taking pictures. Some kids say it sounds like a fan. CT scans are different for everybody, but most scans take about 10 minutes. That's shorter than most TV shows. During your scan, your tech will tell you when it's important to hold still and when it's okay to relax. Your tech can also tell you how long your pictures will take. During your CT scan, the tech will watch you through a camera and will talk to you through a microphone. The tech will remind you to hold still and how much longer you have. If you are getting CT of the chest or stomach area, the tech will also ask you to take a deep breath and hold it for about 5 to 10 seconds. Try pretending that you are taking a deep breath before blowing some bubbles or going for a swim. If you can't hold your breath for that long, it's okay. You can just take slow, gentle breaths. Remember, the most important job you have is to lie very still, especially while you are holding your breath. The tech will let you know each time the camera is taking pictures and when to hold still and hold your breath. If you have an IV tube for the contrast medicine, the tech will use a special machine to give you the medicine in your IV tube. This should not hurt. Sometimes kids say it feels warm when the medicine goes in and can make your whole body feel warm, just like you walked outside into the sunshine. Some kids say when they get the medicine they feel like they wet their pants. Other kids say they have a weird taste in their mouth for a little while. All of these feelings will go away by the time your CT scan is over. When we are done taking your CT pictures, the tech will move the bed slowly out of the scanner, remove the seatbelt, and help you off the bed. If you have an IV, we will remove it unless you have something else scheduled that day. Then you can change back into your regular clothes and leave. A special doctor called a radiologist will look at the pictures. This may take a little while, so you might not know the results on the day you have a CT. When the results are ready, the doctor will talk to you and your parents or caregivers. Now that you know what to expect with your CT scan, there are some things you can do at home to prepare for it. You can practice holding your breath for about 10 seconds. Practice lying very still like a statue while your parent or caregiver takes pictures of you with a camera or phone. What happens to the pictures when you wiggle around? You can also think about which parent or caregiver you would like to come with you on the day of your CT scan, and choose a special activity or a favorite toy to bring with you. Also, there's another video that we suggest you watch. It's about having a CT scan, but with anesthesia. We will let you know ahead of time if your CT scan will be done with or without anesthesia. If you have any questions or worries, please talk with your medical team or your child life specialist. Thank you for watching.